Namani everybody, welcome to Ghana Country. I acknowledge we're reading on Ghana Country. I'm Jackie Worm, Rainbow Hub Project Officer, and delighted to have people here. You've brought the sun out with you, which is lovely. I'm not sure what it's like in Sydney for people joining us from further afield, but great to have others online as well. Thank you. We're really excited to have this community of practice, which has waxed and waned with COVID, of course, but we're hoping to get people's ideas for what they'd like to see in the future, and always love to have extra hands to help organise things. I'll just quickly mention we do run Silver Rainbow training as well, and we're always looking for new organisations to work with, so please consider that and spread the word. We also always promote our community visitor programs, so if people are able to spread the word about having more social contact through friendship, we can do that with people in residential care or in their own homes. And there's some more material over here about the Rainbow Hub, so that's another resource to put into people's organisations. I'll just give one more plug, which is for our next event about LGBTI care perspectives. And there'll be 3 speakers, one from Elder Care, talking about their new palliative care traineeship project. I'll be speaking about our inclusive end-of-life care program or project called Rainbow Horizons. And then Robin Learton will be speaking from ECH about their Creative Communities trial. And that's next month on the 7th of June. So I'll hand over now to Mona. Thank you very much. If you want to introduce yourself and take it from here. Thank you.
Sure. So I'm Mona Kaiser. I'm part of the Silver Rainbow team. And I just wanted to say, first of all, thank you for coming, Zach, because it's a kind and gracious thing to do. It's not always easy to talk about yourself in front of a crowd. No, it's not the first time, but thank you anyway. You're very welcome. So, Zach, I thought we would start with you introducing yourself rather than me choosing what bits I want to introduce about you. So how would you like to introduce yourself or define yourself today?
Yeah, well, thank you for having me, folks. My name's Zach, my pronouns are he and they, and yeah, I was born and raised here on Ghana land. I work for Shine SA as a sexual health counsellor, so I've been there now for the past coming up 7 years. Yeah, I'm a social worker by background, and yeah, that's kind of helped frame a lot of my advocacy and my intent towards human rights and being able to actually be able to live, thrive and survive. I also run the Cannell SA website, sit on a bunch of different advisory and consumer groups. I'm also a very proud uncle of 3 gorgeous boys and a niece as well. Cat dad, dealer of memes and other lame clips, and love anything Batman Lego, and just generally Lego as well. So, yeah. Also sit in a few other more 18 plus groups, so I'm also the current president for Adelaide Leather and Fetish, and the first time in about 35 years that someone who's gender diverse has led a fetish group of that calibre in the country. So, yeah, that's me.
That's a wonderful introduction, much better than I could have done. So thank you, Zach. So I thought that maybe we could start with, after this introduction, your own sort of awakening to your identity, your own journey, because I don't know what experience people have, I don't know what people are working with, so I thought we would just start fairly gently and not take anything for granted.
Sure.
Yep. Right.
So, yeah, I came out a few times. Did the first one when I was about 14, 15. Thought that, was a same gender attracted woman. That didn't quite work. Then got a boyfriend and was like, okay, maybe I'm bi. And then went back into a relationship with a woman again. And then when I was about 23, 24, came out again as trans and then started testosterone. So kind of working out who I was tricky. It's not like it is at the moment where there's a lot of language and there's a lot of media and, there's a lot of discussion around gender diversity. There was no groups in Adelaide that were running at the time that I came out. There was, very scarce images and representation on any type of media platform. And the language was always quite negative, and it was usually geared towards trans women. It was the trans woman who's a murder victim, or she's a criminal or a sex worker in a show. It was always demonised. There was no visibility of anyone who was trans masc. And it wasn't until I was working with someone in one of my former jobs that I was like, wait, I can do that? And that was kind of my light bulb moment. So, I was then very fortunate to connect with a former staff member who used to work at Shine and who's now sadly interstate. She connected me with another individual who, her partner was a trans man. And that was my kind of first introduction to meeting someone and actually realising that I could be myself and I could take those steps. The laws were horrendous at that point. Being able to find a doctor was worse than it is now, and it's still not fantastic. But it was a different time. There was legislation that said who you couldn't see. There was legislation that said what you're required to do to be able to change your gender mark on your birth certificate. It was complicated. And there was a lot of wait lists and expenses, and if anyone ever tells you that being trans is a fad because it's easy, because we've never tried it. It is not cheap, it is not cost effective, and it's definitely not exciting. But it was a long process. There was a lot of loss along the way. There was a lot of relationships that ended, but then there was a lot of things that were also fantastic, like getting gendered correctly for the first time and, being in a relationship with someone who, celebrated who I was, didn't just accept who I was, but actually celebrated me. I've made some amazing friends, and being able to now do what I do as an advocate and as a member of Visible in the community, to be able to then support others through their journey in their way. My oldest client has been 72, my youngest has been 12. So to be able to see those celebrations across the different lifespans it's been wondrous.
So you started by saying that access to information was really poor when you began to think about transitioning. Can you talk a little bit about the timeline? Was that 15 years ago? Was that?
Close to 10 now.
10, yeah.
So there was, good old Dr. Google, and you would kind of log on and have those, Google reviews and things like that. But a lot of the information was American or from the UK. A lot of it was very negative, and then there was just a lot of misinformation. So trying to find anything that was local to Australia. Language has changed over time, so some of the language you would type in different search terms and it would vary in what came up, and then there was very little that was, if anything, that was South Australian. So the time that I came out, there was a group that used to meet in the city, the older second story building, which is now Hyde Street, China Samesh. There used to be a group there, I think it was called Gender Muck, and it folded about 2 weeks before I came out.
It's unfortunate timing. No.
Couldn't have done this a month earlier. But so just trying to find that was really isolating, and thankfully YouTube was starting to really fire up, and there was a few prominent YouTubers, but again they were all overseas, there was nothing Australian. but it was at least visibility, and there was resources at the very least, so that was nice.
So you weren't entirely alone, but it wasn't easy to get access to local information or local people,
Yep.
resources.
Yeah, there was no trans mass groups in Adelaide. The two that did exist were from the gender diverse community, were both predominantly trans women and typically over 40. And at that stage, I was still within the youth category, and I wasn't a trans woman. So yeah, it did kind of feel like awesome. It's great to know that I'm not the only gender diverse person in the room, but there's no one who looks like me. And that, yeah.
So, can you talk a little bit about the 12-year-olds' experience, as you know it, the 72-year-olds, and how it compares to your own experience of 10 years ago?
Yeah, I mean, when we talk about kids, there's a lot of, again, kids tend to be, political handball. We see a lot of young people used as a weapon in the community, particularly with politics. And the reality is that no one's giving kids surgery. No one's putting kids on hormones. Like, where we'll use a blocker when a kid has gone through a certain amount of interventions and counselling and medical check-ins and things like that, and they're completely reversible. It's essentially a pause button. The idea behind a blocker is to try and help the kid's mental health, that they don't go through the wrong puberty and then have to overcome a lot of things that their peers aren't experiencing. So we use a blocker to give that young person time, to give the parents time, and then hopefully, whatever the young person decides when they hit sort of 15, 16, 17, and they're at an age then where they can go, no, I'm absolutely certain this is what I want to do, that we give them the correct hormone, whether that be synthetic or we take them off the blocker and they go through a natural puberty. But it then allows the young person's body to reflect who they are. And it's reversible. That's the most important thing, is people keep going, you're putting kids through surgery and hormones and things like that and you're messing them up. We're not. And it's bodily autonomy, like let the kid with their parents make their decisions. Whereas for the older folk, we've seen a lot of the senior folks who have come through, and it's been, I didn't know I was able to do this, or, like the language didn't reflect it, or I've been in a relationship, quite a few that I've seen, a partner has passed away, and they now feel as though they can come out. A number, it's been a very, they were raised in an environment that was quite negative towards the rainbow community, and they felt that they couldn't be themselves. And it wasn't until there's been a lot more positive language and a lot more positive representation where they've gone, I can be me. And it's really uplifting to see. And you do unfortunately see those who wish they had have done it sooner. But it's about reminding and walking with the person that they're actually getting to be their true selves now. And let's celebrate the moments that they've got now. And for many, they've got a long time where they've felt that, there's been things that they would do differently. But it's been about reminding the person that it's a learning experience. Life is a continual learning experience, whether that be gender and sexuality or whether that be, learning a life hack on some 5-minute crafts video. They're generally shit, don't do it. But, it's about reassuring that they're getting to be their true selves no matter how late in life. But in comparison to my journey, I was mid-20s. So, I've still got a lot of years left to live, and I actually now feel excited about living them. So, there was a point where, I was thinking 30 years, 40 years, getting to my 50th birthday, would I still be here? Would I be happy if I was? What would I be doing? And I'm actually now excited to say that yes, I am. I'm still continuing to do things, and I'm excited to do things. And I just want to make sure that other people can feel that they can too. People don't have to go through what I did.
How would you characterise what you went through?
Turbulent, in a word, but it was character building. So when I transitioned, there was one psychiatrist, one medical provider, and one surgeon. And you needed to, receive referrals from each of them to be able to see the other. And wait lists to see the psychiatrist were 18 months to 2 years. And surgery was about 10 grand. And they don't even offer lower surgery under 100,000 for all 3 stages in Australia at all. It's only been the last couple of years where we've even got a surgeon. The costs of hormones and the shortages of hormone supply, for anyone who's on a hormone replacement therapy, know that it's been a nightmare. But it's been interesting. There's been a lot of changes in legislation. There's been a lot of changes in, when I changed my gender marker, the legislation literally stated that I had to have an irreversible medical procedure to my reproductive anatomy. So it was, thankfully for me, top surgery was sufficient, the removal of the chest tissue. But for many interstate, that New South Wales and Sydney and Queensland, it's still reproductive organs. You're still forced to have an organectomy or a hysterectomy. Essentially, you need to be surgically sterilised in order to have your gender marker affirmed. And when I did mine, I had to stand before a judge. Usually it was closed chambers. The one day that I happened to go there, the judge was sick, so I had to go to another court. And there was some proceeding before me, and they were all still in the room. They're like, "Hi, so you're trans and you want to be a dude?" And I'm like, "Yep, that's the thing." And they're like, "Cool, I've never done this before, but paperwork says guy, awesome, here." So people don't typically have to go stand in front of a judge to get their gender identified. But thankfully those things don't exist anymore, and it's still ongoing for some states, but it's getting better, but it's still not here.
So there's no federal standard in this stuff, it's state by state?
For birth certificates, it's every state has its own legislation. There's an overarching federal document, but that doesn't change birth certificates. The Australian Government Guidelines for the Recognition of Sex and Gender 2013 allows you to change your passport, which a lot of people do. And back when that was first implemented, they already had an X gender marker. They could already put X back in 2013 on your passport. South Australia didn't do it until 2017. We've still got 2 states that haven't done it.
But you've talked elsewhere, Zach, about 1988 and legislation about sex reassignment.
Yeah.
Can you tell us a bit about what it was like then? Because that sounds very different to what it is now, though it's not beautiful now, it sounds better.
So the Act was repealed end of 2016. Equality Australia helped get that Act repealed. And there was a number of advocates, of which I was a part of, to remove that. But the original Act, when the Act came in, it was revolutionary. It actually meant that, we had a medical clinic at Flinders, and that they could provide a service, and that, we were able to actually provide healthcare. But as the years went on, and as, services shut, and health clinics were closed, and as, human rights became, more about equity and access to healthcare, the legislation became more and more cumbersome and more detrimental. And because it was everything had to be Attorney General approved, if you didn't have a supportive Attorney General or an informed Attorney General, or if you just couldn't get things through, it essentially meant that you weren't able to access care. Or if you did, you were kind of illegal, which I was, because I didn't follow the process. I went through a GP who was informed and affirming, and by the time I got to the psychiatrist, I was already on hormone therapy. So technically, I was an illegal trans.
You slid through the process. All right. But when you talk about equity of access, how do people pay? I mean, it's a long process. It's not a cheap process. Yep. How is it covered?
It's not. So, yeah, see hormone therapy, if you're lucky to get in with one of the public health clinics. So Shine has a sexual health physician, but the clinic's overwhelmed. They had to close the books, can't take any patients. The Modbury clinic runs for half a day, 1 day a month.
Wow.
And they've got around anywhere between 12 to 18 month waiting list at the moment. Otherwise, you go private. And yeah, we've only got 2 endocrinologists in the private sector that do this work. Despite reaching out to other doctors and GPs, there's now guidelines for standards of care for informed consent models for GPs. There's no legislation that says that GPs can't work with trans and gender diverse individuals. Many are just not trained, many don't have the time.
Yeah.
And yeah, otherwise everything is private. If you're lucky enough to get into a counselling service where they bulk bill or reduce cost, that's perhaps a bonus. Surgery, there's no public surgery in South Australia. On average, you're looking between sort of 10 to 15 grand for chest reconstructive. Lower surgery, you're going into state for trans women and trans femme folks, so you're looking at around 25 to 30k. And stage 1 for someone wanting penile construction, you're looking at about 55 to 65,000 just for stage 1. That's just the creation of the phallus. So, yeah, there is some coverage with private health, but it's a couple of grand at most. It's nowhere near enough.
Who supported you in your process?
My parents were amazing, actually. I came out to my mum, my dad. I came out, it was a Saturday night, and I said to mum, Dad was in the kitchen, Mum's in the family room. I'm like, hey, I've got something to tell you. And they were kind of like, let me guess, you're a dude. And I'm like, well, actually. So, yeah, it took Dad a little while to come around. It took him about a month or so to really sort of get his head around what was going on. Because as soon as I told them, it was like this weight had just lifted. I'd been watching these things in secret on my computer, and I've been reading all of these things online, talking with people. And by the time I came around to tell them, they were all like, well, this is now just rather sudden. It's like, no, I've now just let you in. Like, this has been ongoing in the background for quite some time, and I think that's a familiar journey for many of us. But my dad, once he did come around, was like, all right, come on, my boy, let's go. And do all those things, and it was really sweet. Like, my parents renamed me. I knew that the name Zach was the name that they had picked out, because, that was, those conversations of what would open if I was born a boy. And my middle name was Alan, which is my dad's name, and he was really chuffed that I chose to take that. And it's been from my parents' perspective, it's been a really heartwarming journey. They've been super supportive. They put an ad in the paper and were like, congratulations, it's a boy. 24 years later. So, it's really sweet. I did lose a number of people along the way. There was family that I did lose. It wasn't all, rainbows and unicorns. But for those that did support, it was incredible. And it really did drown out a lot of the negativity, because I did have those people in my life who were just with me.
It's very moving to hear that your parents named you Zach, and
that's was very fortunate.
Yeah.
So unfortunately, we know that no matter where you sit on the rainbow community, that you do run the risk of not having that familial support. And I was very fortunate that I did.
You're working a lot with this, I think, now, aren't you, with mental health issues? Can you talk a little bit about that? Because you sound like you had not a smooth path, but a better path than some people, because you had parental support.
For sure. No, I mean, we see time and time again that the statistics in the community are absolutely horrifying. We look at the rates of mental illness, we look at the numbers around suicidal ideation and attempts, and it's not because people are trans and gender diverse, it's because of the layers of loss and oppression. When those layers are removed, go figure, but people's mental health gets better. So, yeah, we're seeing, unfortunately, the numbers around, for the gay male community, suicide rates are around 10 times higher than they are in the straight male community. For the trans and gender diverse community, the bisexual community, I think we're looking at about 15 times higher. Women tend to be a little bit lower, depending on, also then add factors like regional groups and, culturally and linguistically diverse and First Nations groups. They do shift significantly, but consistently, the trans community tends to be around 50%. So, when we look at the current political climate at the moment, trans and gender diverse is everywhere in the media. It's a political nightmare at the moment. It's exhausting. We thought that the plebiscite and the discussions around same-gender marriage were a nightmare. But now you're talking about not just a collective group, but a minority within a minority, and an already significantly oppressed minority. And we're talking about just basic access to healthcare, where in addition to all of the other factors, it's hard. But for many, it's loss of job, it's homelessness, it's losing their friends and family. For young people, it's disengagement, disconnection from school and community groups. For our senior citizens, and it's those loss of families and supports. It's a lot of our aged care services are faith-based, and it's not being able to be yourself in supported accommodation and residential care. Those things are still ongoing. So when I'm working with different age groups, it's not just the person struggling with their own body and their own sense of dysphoria. It's those external factors as well. And it's scary. You can see why people are experiencing anxiety and depression.
If we talk a little bit about aged care, since we've landed there, what do you think people's concerns? I know we're not talking about a huge number of people, but from your experience, what are people's concerns going into aged care?
That they'll have their care denied. We unfortunately have had a number of people who, they've been told that their medication for hormone treatment, because it's something that I'll be on for the rest of my life, is not necessary, and that it's stopped. That they are misgendered, that they're not respected for their health care. I still have a cervix, so I've still got to do cervical screenings and all those kinds of things, and they're incredibly discomforting for anyone, let alone someone who doesn't look like the typical service user. But yeah, for a lot, it's incredibly scary. We know that from many reports, and I've unfortunately read many mental health and service reports where trans and gender diverse individuals have said that they would rather take their own life than go into residential care. That's harrowing. So when we see services like Silver Rainbow doing things like this and trying to educate and inform and just trying to remind people that, queer healthcare is healthcare, that's why we do what we do. That's why we're all here today.
What would it look like, in your opinion, Zach, if people had agency when they went into, residential care? And how does an organisation signal that to potential clients or residents?
Make the changes that are visible. You're always going to have groups who are vocal opposers, but it's showing true allyship and it's standing with community groups. So putting those groups, just as we've got with COTA, they've got a community group that actually stands and helps inform policy and procedure. Do that in your workplace. Make sure that those staff are represented to help influence the care that's provided to their clients. Put things on their intake paperwork. Chosen names, pronouns. What healthcare do you need? What things make you feel more comfortable in accessing healthcare? And I don't know how many times I had to tell the doctor when I went pre-transition that no, my abdominal pain is not pregnancy related. It's impossible. The person I'm sleeping with is not a trans woman, it's a cisgender woman. So, acknowledge people's healthcare, acknowledge people's standards, but also don't deny them healthcare. Can't believe I need to say that one out loud. But yeah, put things that are visible around your workplace. You know, are your posters just heterosexual, cisgender people doing their thing, or have you got people of colour, have you got people with disabilities, have you got same gender couples visible? Make it, you know, you might have a rainbow up, but, you know, don't be tokenistic with it. Take it to that next step. It's, yeah, bring the community to the table and actually put them in positions of power. Don't just be like, hey, yeah, we held a forum. Excellent, what did you do with that?
So the question that underlies that is, how do you communicate to organisations that that stuff is important in amongst their other priorities?
There are so many research reports, there are so many documents that already state what they need to do.
Yes.
I mean, here in the background on the screen opposite me, I'm looking at Matt Morris, you know. He's the one who sits within government at the moment who, you know, helps guide a lot of those panels and, you know, those discussions and forums. Talk to those people who are in those roles. Contact Shine SA. We do the LGBTI how-to training. Contact COTA. They do the Silver Rainbow training. There's already organisations who can provide those resources to make it so that you can just implement those changes in the workplace. Rainbow Tick accreditation exists. There's an entire scaffold on how to make policy changes in your workplace to be safer, not only for consumers, but also your staff who are part of those community groups too. Because it's not just about the clients, it's also about your workplace culture. If your staff aren't feeling supported, aren't feeling informed, how are they going to make that then taking it out to the client group? So programs already exist.
Absolutely, but you often hear, well, we have some diversity training.
Yeah, the tokenistic, yeah, we did a, yeah. I love the tick box ones as well.
Yeah.
Yeah, they're great.
Yeah. Yes.
You don't have to reinvent the wheel.
Yeah.
They're already there, but make it genuine. It's not just about, you know, you did a, you know, you watched a 15-minute video as part of your induction training. Keep it going, refresh it, make it mandatory as part of, you know, what we all do, the hand washing training, we all do the child safe environments, and we do the, you know, the heavy lifting and everything like that. Just make it as part of the standard workplace update. It doesn't take it, and it makes a heck of a difference to someone's well-being.
What about safety, just to extend that a little bit, safety in the workplace, whoever's workplace or home or whatever it is?
Yeah, I mean, some of the simple things, you know, pronouns. Pronouns are, you know, something that we're seeing people go, I'm so sick and tired of hearing about pronouns, and I'm so sick and tired of hearing about gender-neutral pronouns. The reality is we use gender-neutral pronouns every single day. If you don't know somebody and you go, oh, there's a knock at the door, cool, can you go let them in? Or, you know, someone left their bag on the bus, I hope they get it back. Just replace that with, you know, Matt left their bag on the bus, hope Matt gets it back. It's the same thing, it's not a big deal. But, yeah, you know, those little things like, you know, acknowledge days of visibility, days of remembrance, the same things that we do, you know, most of us have workplace newsletters and things like that. You know, throw in a, you know, upcoming IDAHOBIT event. International Day Against Homophobia, Biphobia, Intersex Phobia and Transphobia. Don't be one of those people that carries on about, you know, what the rainbow's getting too long. It's like, yeah, it might be, but those people within those letters are people with thoughts and feelings too. If someone says to you, you know, oh, using, you know, changing pronouns is hard, try living it. A little bit of empathy goes a long way. If you see that there's a petition coming out, it takes you 5 seconds to click yes, add my name and signature. It makes a big difference. If you do get the opportunity, if someone says to you, hey, this is what I'm going through, they're inviting you in. They're sharing their journey with you. They consider you a person that they want you to know that that's what they're going through. Celebrate that with them. If that's not something that you can do, that's a reflection on you, not them. Don't make it about it. A good ally knows that when someone says, I'll use the not all men thing, for example. When people turn around and go, men are shit. We know that it's not all men, but the dude in the corner doesn't need to make a big song and dance about it. That goes for every community group. Being a good ally is knowing also when to shut up. We just want people to stand with us. We just want people to then, when we're exhausted and tired, help speak with us, not for us or over us. And you can do that no matter if it's a workplace, an education group, if it's a residential care service, or if it's a family friend. We can do that in any aspect. Don't make assumptions, don't make judgments. Nobody likes them, they get more hurtful than not. We say stereotypes are a thing for a reason, but usually they're negative. It just doesn't cost a lot, to be honest.
Oh, that's a great thing to say. Yes, absolutely. All right. So it's about, like, when you say, people saying that there are too many letters and it's a burden for them. It's about cultural change. It's about societal change. When I lived in Sweden, I became really aware quickly that it was very different there than it is here.
Yep.
And in Swedish you say han for him and hon for her, which became hen. So that was the pronoun, and it caused nobody any issues, and it came in very smoothly. Of course, there had been years of work before that, but the cultural change, the environment was ready for that to be accepted, and it was.
Yeah.
So
we could always just go back to the 1900s when everything was just default male. People don't like change. Let's just default back to that.
Yeah, no thanks.
Right? Oops.
No, it's about empathy, human rights, and absolutely, for sure.
I see quite frequently, and I had an absolute giggle when I saw that, when people were talking about trans women, they were going, it's just women in dresses. It's like, well, if you go back to, early cinema and theatre, women weren't allowed to be actors or on stage. It literally was just men in dresses. Can we not go back there and can we, just bring everybody to the table instead of saying, no, it's just this group? Like, change happens. And that's a part of life. And you can either get on board and enjoy, or you can let it sit and dwell in negativity and rather take up space in your own head. I know what I'd rather do.
The new norm, or at least possibly.
Things change. We're no longer using horse and cart either, so...
Things change, hallelujah. How are we going on time?
10 to 4.
10 to 4, all right. Let's see. All right.
Comments or questions from the floor? I would like to say, because I work for elder care and was part of the team that got us the Rainbow Tick in 2019. And part of our feedback from that was, we got the tick, but there was areas for improvement. And one of them was to have a better sexual health policy, which we're writing at the moment. It's actually been a really hard time because everyone's been involved in nothing but COVID for the last 2 years. But we do have a draft policy and a draft procedure, and you're right in the sense that to take 1,500 people across, in the staff group, which I think we have done quite successfully actually. Our culture has really moved and really does live and breathe elder pride across all areas, I think. All those that aren't on board understand that that's outside of work, and when they're at work, this is the values they hold. But the transgender group is a group within the group, which I think we're still coming, we've come a certain way, but I acknowledge that there's still work to be done in this space. And that was something that was highlighted to us at the last bit of feedback. And, in our conversation at the beginning, when we were talking before, it is sad actually that even though as a organisation. We are really supportive, and our staff and volunteers are fantastic. It's very evident that residents themselves still have a lot of fear, and very few, really few come out. And it's heartbreaking, really.
It's a reflection of the time, I think.
And also their age group, their peers. There's just so much fear about judgment, and so deeply embedded.
Well, if you look back at that generation, I mean, I look at what the queer elders before me have done, and it was literally like it was illegal. We saw people arrested, we saw people beaten in the streets, we saw the HIV and the AIDS propaganda, and we look at the history of what people have been through, and things may not be they're not great now, but what people have been through beforehand is not to be dismissed either. We're standing on the shoulders of giants, and it's a lot of fear. It's a lot of, there was a lot more discussions around religion, and there was a lot more discussions around, what's right and wrong, ethically and morally, and a lot of that was instilled and threatened quite significantly. So when we look at some of the older generation, I talk to people that come through my rooms, and, I see those discussions online. Language was also very different then, so it's...
I think it's almost PTSD. It's, just something that is just too hard to overcome for most people in their 80s and 90s in a residential aged care setting.
Which is where if you do have someone who is able to share with a carer or a medical personnel, that's a huge win, both for you as the person supporting that resident, but also for the resident too. Thank you.
Yeah.
Right, by the way, Elder Care was the second in South Australia to get their own boutique. Well done.
Hope you wanted to say something. Thank you, Mariam.
I don't know if you've heard this, but when you transitioned, did you notice a difference between the way people treated you from being a woman up to 23, 24 to a man? Like, are you treated any differently?
Significantly. Male privilege is a real thing. So when, I've now walked up to spaces and, I'll be standing next to someone who was very much there before me, and they happen to appear female. People will still ask me a question first, and I'm like, sorry, you were first. But there's also, moments where I've realised that, men are also stupidly competitive when it comes to, who's the alpha and who's not. There is a thing that some more aware men are doing at the moment, this came from a feminist movement, this came from women, and it was literally around, playing chicken with other guys. So you'd be walking down, like Rundle Mall, for example, and you would see this guy who was clearly not going to move out of the way. So you would challenge him. Who's going to be the first to bump shoulders with who? And you walk into one another and you go, oh, sorry, mate. But it's about proving a point. And especially if you're someone who is visibly queer, like I'm usually wearing something obnoxiously trans or queer. But it came from women who were sick and tired of being walked all over.
Sure.
And there's been times where it's also been, I've had to realise that even though I'm not a perpetrator, men statistically are perpetrators. When we look at all of the reports around this, child sexual abuse, rape, violent crimes, they're statistically men. And there's been times, I was in the SES for a few years, and, so one of my training courses was around missing persons and kids. So, you'd be at the Royal Show, and when you're in uniform, people come up to you, they want to, get a photo with you, things like that, but you're always really mindful, like, where are my hands? What's my body language like? I remember being in a shopping centre in one instance. There was, I'm not sure if people are familiar with Tea Tree Plaza.
Yep.
Upstairs where Big W is, there's a really long corridor where the bathroom is. and there was a woman walking. She had a trolley, she had a small little bundle in the trolley, and there was another little human kind of just running up ahead. And I could see that this kid was like seconds away from clearing the doorway and being out in the middle of the mall. She's screaming at this kid to come back. Kid's having a field day and gone. So I've stepped and stood up. I'm sitting on the benches next to her. I've just gone, hey buddy, come back to mum. All of a sudden, mum's come barreling down the corridor. Get your hands off my kid. And mortified, I'm like, shite. I was trying to help, and now everybody's looking at me like I'm trying to abduct this kid. So it's being aware of those things. I've seen women cross the street when I've been, it's just the two of us. So it's just being aware of those things. I don't take them personally because I know that it's not about me. But it's also about calling out other people. Like, I take great pleasure in calling out other men online when they're, coming in and they're commandeering spaces. And so, sit down, mate. For once in your life, shut the fuck up. You just kind of sit there and it's about being an ally. But the way I've been treated, the way I've been seen, yeah, it's absolutely changed. Male privilege is still very, very little.
And passing privilege.
Oof. Yep.
Yeah.
So,
And what?
passing privilege.
Passing privilege. Mm.
So, I am very fortunate that when I go, I identify as male, nobody questions that. It's not usually even until I out myself or someone's Googled me that they've gone, oh, he's trans. He wasn't born female. I stand nearly 6 foot tall, thanks to my mum's giant genes, and testosterone has been quite kind to me. Not everybody experiences that. Quite commonly for our transgender women and trans femme individuals, overcoming a testosterone-based puberty, there's only so much that an anti-androgen and estrogen can do. So, yeah, unfortunately, for some trans and gender diverse individuals, they will say this is how I identify, and unfortunately, people will go, well, based on my understandings of gender and presentation, you don't quite fit that. So, yeah, I do have the privilege of walking into men's spaces and no one bats an eyelid at me. I do have the ability to be able to go to most items of clothing, typically the larger guys section, I'm in shape, crowds are shape, where you kind of go, yeah, I can walk in and this is going to fit me. People are going to gender me correctly. No one's going to go, oh, I'm sorry, miss, what we're up to. And it's like, you're blind? I don't get it. Nobody looks at me and goes, yeah, woman. So I do experience passing privilege. So, yeah, it's still a thing.
So much to ask you. So little time. I think that we're out of time. Would that be right, Jackie? It's at about.
People might want a bit more time than
Yeah.
me. I just wanted to point to a resource that I think is being updated, that LGBTI QI Health Australia Gender Passport. I'm not sure I've got the right title there.
It's an awesome resource.
Yeah, it goes into detail of, and people can fill it in and say, with personal care, I would like this gender person or that gender person, right through to end-of-life arrangements. And that's a really good resource for organisations to use in, checking their processes and aligning things with, and for education purposes. Some copies of it, and I believe you can also find the link online.
Yeah.
But yeah, I just think for getting into some more specific things for people to think about, I found that a really great resource.
Yeah, there's some really great resources for trans and gender diverse healthcare. Trans Health SA is a website that I operate here in South Australia, just to try and get as much information that's local out to people. It also does have national links and international links as well. But yeah, there's the Rainbow Directory, it has notes around things as well. But think about the spaces and the changes that you can make. Like, if you've got 2 single stall bathrooms, do they need to be gendered? Can you put sanitary bins in both of them? You know, looking at things like language. You know, I'm one of those people at the moment, you know, I'm sitting there and I'm watching all the discussions about the atrocities in the US and abortion access, and you sit there and you go, but no one's also saying that this does impact trans men and non-binary people too. We know that this is predominantly a women's issue, but also just be mindful of language that, you know, you can go women and anyone with a cervix. By adding a couple of words, you're showing an entire group of people that you are acknowledging that their access to healthcare is now impacted too. It's just about being mindful of those things. No one's taking away from anyone when we're going, okay, do you chest feed? No one's now saying that women don't breastfeed, but we're saying that they're not the only ones. It's about including more people. Like when we go, you know, there's no need to go, all right, good afternoon, ladies and gentlemen. When you can just say, good afternoon, everyone. Everybody's included, no one's excluded. We're not taking away from anything. We're finding ways to make sure that everybody's at the table. And resources like the trans and gender diverse passport, anyone can technically use it. So not everybody is super okay with some of the language that people will use for body parts or for medications and things like that. You don't have to be trans and gender diverse to use it. But it's a really great tool for those who need it.
30 seconds. Who inspires you and why?
There's a lot of people. I mean, I could give the cliche, my mum and dad, they inspire me every day. My nephews, because they make me smile. But, yeah, I don't know. There's a lot of people in my life, and I think it'd be too difficult to narrow it down. But, yeah, people who are trying to make a change. People who are, you know, wanting to make our community better for each other. It's fine.
Thank you very much, Zach. Thank you, everybody. Yeah. And I don't know if you heard what Zach said. Thanks for being here. Thank you so much.
Yeah, it's one of those things that, you know, we know that for those of you who are here, you know, you're already keen on making a change and learning and listening, but I also know that you then take that out into your other spaces as well, and that's hugely valuable. So,
Thank you.
and to those online, thank you for you as well.
Thank you.
Thank you so much.
Please stay and have something, some afternoon tea and yes, network.
Yeah, and if anyone wishes to chat with me, ask me anything, by all means. No question is a silly question.
Thank you very much, Zach.